Good evening, the conference organizers. I'm Emmanuel, presenting a topic titled Oral Cavity Protozoa, Prevalence in Dental Patients in Ebonyi State, Southeastern Nigeria. I have nothing to disclose. Background of the study. Oral diseases pose a major health burden for many countries and affect people throughout their lifetime, causing pain, discomfort, and disfigurement, and even death. It has been predicted to be on lingering increase in most low and middle income countries. The Global Burden of Disease Study 2017 estimated that oral diseases affect close to 3.5 billion people worldwide. Study area. The study was conducted in dental clinic at Federal Teaching Hospital, Abakaliki, Ebonyi State, Eastern Nigeria. It is designated by the following coordinates: 6 degree 20 minutes north, 8 degree 6 minutes east. It has an average annual rainfall of between 1,750 to 2,500 millimeter rainfall, and also an average atmospheric temperature of 27 degrees Celsius. Sample collection and sample techniques. 180 patients were involved in this study, and we use sampling method of convenience non-probability sampling techniques. The biodata, such as age and sex of the patients involved, were obtained through their individual patients folder. Dental plaque and dental calculi were collected using scalars and preserved in 2-meter ringer solution. Saliva samples were also collected using sterile swabs and then transferred into sterile containers. Parasitological studies. The first was wet preparation. Just from a simple homogeneous mixture of each sample, a drop of the sample fluid were placed in the center of clean grease-free microscope slide, which was carefully covered with a cover slip and properly mounted on a microscopic stage for identification of the various protozoa and trophozoites using 2 objective lenses of times 10 and 20 respectively. Permanent staining was also conducted using the GEMSA method. Both thick and thin films were prepared. Microscopic observation was made using times 10 and 20 objective lenses. Thereafter, the presence of T-tenors was recorded as a pear-shaped flagellated trophozoites of about 5 to 13 micrometer length with circular movement, while the presence of E. gingivalis was observed or recognized with prominent pseudopodia and sluggish movements, and also a length of 10 to 20 micrometer. Results. Table 1 displays the information on the prevalence of oral protozoan parasites among patients with respect to their sex. In a word summary, out of the 180 patients that were observed, 108 were female, 72 were male. Out of the 72 male, 28 were infected with oral dental protozoans. Out of the 108 females, 44 were infested with protozoan parasites. But the female had a higher parasite prevalence compared to that of male. Also, among the 40 female that were infested, 16 had E. gingivalis, 18 had tetanus, while 10 experienced mixed infection. Out of the 28 males, 12 had E. gingivalis, 6 tetanus, 10 mixed infection. Figure 1. Figure 1 displays the result on distribution of different parasites according to sex. In a word summary, this result shows that a greater percentage of the male had E. gingivalis compared to that of female, whereas a greater percentage of the female were infested with tetanus compared to male. Among the mixed infected fellows, the male outnumbered the females. Table 2. Prevalence of oral protozoan parasites among age groups. By way of summary, it is shown in this table that prevalence rates correlated with age. The more the patients advance in age, the more the rate of oral dental protozoa infection. For instance, those patients among the age bracket of 50 years and above had a prevalence rate of 81.5%. That is the highest. While those patients within the age of 20 years and below had the least prevalence rate of 16%. Conclusion: E. gingivalis and tetanus were the two protozoan parasites isolated from the oral cavity of dental patients throughout our studies. Although the exact contribution of these organisms to dental diseases is not known absolutely, however, their prevalence among dental patients, especially those with poor oral hygiene, probably underscores their correlation with dental diseases. Therefore, intense oral hygiene awareness campaigns should be carried out to enlighten the populace, especially in underdeveloped and developing countries. Thank you for your audience.